One, let's get
All
to
right,
it.
so we're going to start. So welcome. Some of you may already know Helen, Heidi, and myself, but if not, Helen Cahill, Heidi Jacobs, and Caroline McCormick. And welcome. We all work here at the sales offices in Knollwood. Our primary focus is independent living, but we also are involved with the selling of assisted living, and people often have questions about nursing care. So today we're just going to focus on the difference between assisted living and nursing care. And so hopefully you'll learn a lot. This session will be recorded, so you can go back later and
Watch it. If you go to knollwoodcommunity.org, there's an events tab on the top right. Click that, and then it will take you to our webinar page. And all of our previously recorded webinars are there. A lot of the most popular ones are our Meet the Residents, which is a great way just to see what type of different people live in the community.
and hear from them instead of us.
Yeah, get their point of view, which is great.
So we will move in. And this is just a little bit of general information about Knollwood that Heidi could share with you.
So Knollwood's a nonprofit community, and we are located, if you're familiar with Rock Creek Park, we're right across the street from it. So it's beautiful. When you drive in, you feel like you're in a neighborhood, because you are. And we're a lifetime community for people who are 62 and greater.
And one thing that's neat about our neighborhood, we're in Northwest DC, we're almost in Maryland. But when Heidi says we're on Rock Creek Park, literally, there's a crosswalk at the edge of our property to Rock Creek Park.
Yeah.
So it's a really great place to live and work.
And gives us beautiful views from all of our apartments.
That's true. It does indeed. So we'll go on to our, tell you a little bit about kind of what you can get out of the program today. So we're going to go over the differences so that hopefully you'll be able to recognize not what is assisted living or nursing care, but if you're thinking of a friend or family member, hopefully it'll help you recognize how to steer them. There's a lot of acronyms that are used for both assisted living, nursing care, hospitals, all that. We won't be using them today. We will be using words in English so that you can understand without any miscommunication. We're going to review some of the criteria for assisted living and nursing care for living in it, because there are. And also people also want to know, how do they pay for it? So we'll cover all of those topics for you today.
We love to, in both this webinar and the one we did a couple weeks ago, which is independent living versus assisted, we love to do these tests. So we're going to do 2 test scenarios. We're just going to discuss them and then think about the answer, and we'll come back to it towards the end of the presentation. Okay. So I'll start with this one with Jane and John. We live in a community. It's got programs, which is wonderful, housekeeping and dining. They both need medication reminders. Jane gets around easily. John's a little bit slower. Jane doesn't cook or clean anymore. Their apartment has a kitchenette. Jane has help with showering, and John has a stable but chronic illness. So think about that. Do you think that's more assisted living or skilled nursing? Okay.
Is there one more test? Yeah. I think you can have this test.
All right. So Julie lives in a community, and they have all kinds of social programs, fun things to do. They also offer housekeeping and dining. And she does get around with a little help, has quite a bit of trouble with incontinence and several medical issues requiring monitoring. So she also has diabetes, and she cannot be counted on to stick to her own diet. So where do you think Julie fits the best?
So now we'll talk about life plan communities. And it's kind of important to talk about this, even though our topic is assisted in nursing, because throughout the US, and of course, the same in the metro area that we live in, there are many different types of communities, and it can be very confusing. A life plan community is what Knollwood is, and it has independent living and skilled nursing all on one campus, one provider. And some life plan communities, many do, also have assisted living, as does Knollwood. But there are a lot of freestanding apartment buildings that might be age restricted, but for independent living. There are also a lot of freestanding communities that are for assisted living. Some combine assisted living and independent. There might be freestanding nursing care centers, or less common are combination assisted with nursing care, skilled nursing care. So we're gonna delve into the assisted and nursing now. But first, I guess we have to talk a little bit about lingo.
Yeah, so as Caroline previously mentioned, we are gonna break down some of the different lingo you may hear while searching for yourself, family member, friend. As mentioned, we are a life plan community. There are different types of life plan communities. So we are a type C, which is often referred to as fee for service, which essentially means you are paying more as you move to a level with care. So independent living, you have your monthly service charge, but you're not getting care. You move into assisted living, which has levels, you're paying for what level of care you are getting, and same with skilled nursing. There are other two types, type A and type B. Type A, you are kind of buying into future care that you may or may not use, and type B, there is kind of a long-term care discount associated.
Yeah, so you're still buying into care that you may or may not need, and then you get a discount if you need it.
Yeah,
So with Knollwood, it's just pay for it when you need it, if you ever need it.
exactly. Other words you might hear are continuum of care. Life plan communities used to be referred to as CCRCs, continuing care retirement communities. So that kind of falls along with that. And then two different things that we're going to talk about are instrumental activities of daily living and activities of daily living. They are not the same. And it's important to have a good understanding of the difference between them.
But one thing I forgot to mention, if you do have a question while you're watching,
Yes.
you can actually key it in using your keyboard. There is, if you hover your mouse along the bottom edge of the screen, you'll see a Q&A where you can type in, or chat where you can type in. And if you do that, we will see your question, and then we'll have it answered for you while you're watching the program today. So, yeah, so
Looks like we already have a Q&A.
we do have somebody asking a question
I
already.
see that. Okay, Q&A. Does Knollwood have memory care? Okay. Great question.
Yep,
I'm not on my phone. I'm just reading your questions.
yes,
to
she has to
Caroline
read
and
your
Heidi.
question on the phone.
Okay.
We can't, our screen is too far away.
Yes.
So yeah, no, it does have memory care. It's at the nursing level.
Yeah, which does make us a little bit different.
It's very unique.
Mhm.
Most places have memory care at the assisted living level. Then if you need more care, you would have to leave and go to a nursing center.
And I'd just like to touch on that because I worked for a freestanding memory care only community,
Mhm.
and we still didn't have nursing care.
Yeah.
So we often, I would say probably maybe it was 150 apartments in our community, and I'd say 4 to 5 different people a month had to be discharged to the higher levels of care with memory care. So us having the nursing is great because you don't have to move your loved one again if they're in memory care.
Yeah.
Well, that was a great question. Thank you. So you want to take this one since you were, yeah,
Sure. What are we doing? Okay. the
Instrumental
so that
activities.
people will understand. the
Yeah.
difference.
Absolutely. So instrumental activities of daily living are maintaining your house, cleaning your house, being able to just basically manage the basics of running a house, like managing your money, cooking your meals, getting your groceries, being able to use your phone and things like that, pay your bills on time.
So you're actually independent.
Yes.
So think of instrumental. It begins with I, and the word independent begins with I. If you can do all these things, then you're a candidate for independent living. And probably not a candidate for assisted living unless you have maybe some disability. That would be. But certainly somebody who is becoming very frail, facing a decline, whether it's cognitive or physical, is probably going to become unable to do some, many, or all of these things.
Yep.
And this one, if you have a long-term care insurance policy, actually let us know if you do, and we'll invite you to workshops we're gonna do next year. But a lot of people who have a long-term care insurance policy have heard the term activity of daily living in the past. Which is definitely different from instrumental activities of daily living, and we can talk to Ms.
Yeah.
Helen.
So these are things you are going to hear talked about when thinking about assisted living versus skilled nursing. What can the person, the individual, the resident, do on their own versus what do they need assistance with? Bathing, so your activities of daily living are going to be bathing, dressing, grooming, toileting, going to bathrooms, transferring, functional mobility, and can you eat on your own? And so if you're in assisted living, typically you're going to be getting help with some of these. And in a skilled nursing setting, you're going to be getting help with probably all of them or almost all of them.
Yes.
Yeah.
Very good.
Okay.
I can see there's a question there, but I can read it, but it is just someone has long-term care insurance and they say it's Genworth, can they use it at Knollwood? I'm looking at a big screen over there for those of you who don't know. But long-term care insurance is not like health insurance, so I don't have to go around and say, do you accept this insurance? What your long-term care insurance is going to pay out if you're in a place that's licensed and insured. And Knollwood's assisted living is licensed, insured, regulated, as is the skilled nursing here.
And what they require for you to use your long-term care is for you to need some help with your activities of daily living.
Possibly, or cognitive decline.
Yeah, that will be dependent upon your particular individual policy.
Yes.
But yeah.
Mhm.
Okay. Lingo,
Yeah.
aid lingo.
Yeah, so there's home health aides, home care aides, nursing assistant aid, medication aid, and companion. So to kind of just, should I tell them what they are?
Oh, yeah.
So
Yeah.
the difference between a home health aide, home care aide, you're gonna have people that are able to actually do help with your activities of daily living. They can help dress you, they can help assist you with bathing. They've been trained on how to transfer you from a chair. A nursing assistance aide is going to be able to do more of, helping with incontinence items or like catheters, tubing kind of things, wounds, diabetes, injections.
Sometimes nursing assistants usually aren't going to do an injection. It's usually going to be a nurse.
Okay.
Yeah.
And then there's the medication aid. That's somebody that's able to hand out your medications. In some states, there's a requirement for you to have a different
Like Maryland is one of them.
Certification.
Maryland, Maryland actually has certified medicine aides as well as certified nursing assistants.
I've never been anywhere they do that. So
Yeah.
And then-
don't.
a companion is someone that can come over and do your dishes for you and help you run your errands. But they're not necessarily trained to dress you or give you your medications.
They can't do hands-on.
Right, they can spend time with you, but they're not supposed to be like
touch.
touching you.
Right,
Yeah.
Yeah.
Even
by
with-
regulation.
Yeah, by regulation, like even help with dressing, they're not supposed to be doing. They're not supposed to be get your pants on, that kind of thing. So it's
Well,
good to know.
And if you've ever helped somebody that needs help, you can really hurt them if you don't know what you're doing.
Yes, or vice versa, they can really hurt you, if they're
Exactly.
unsteady.
It's true.
So this is all for the safety of the individual. Mhm.
And also it's important to know if you do have a long-term care insurance. A long-term care policy is probably not going to reimburse for a companion. If the person needs somebody to help them with any of the activities of daily living. A long-term care policy might reimburse for a companion if they're just there to maybe watch over somebody who maybe is at risk of wandering but doesn't need help with any of their daily activities, but just needs watching over for cognitive reasons. They can cook and shop. Take you to your doctor's appointments.
Which is very helpful. Yeah.
Here's a page full of acronyms. Again, while you're shopping, I'm not going to read the acronyms or the lists because you can all see them, but you're going to come across a lot of acronyms, possibly if you're out looking around. You won't at Knollwood because we prefer to use words, so you won't see any of this information in our literature or on our website. Because we know that you speak English, and so we are going to as well. But if you do come across an acronym, especially depending on what your own personal area of expertise is, maybe you're somebody that went to school and got a degree in the sciences. Well, these acronyms may mean something totally different. Or if you're a finance person, these acronyms may mean something totally different in your discipline. So I just always encourage people, if you see an acronym, look it up. And then you'll see how many different translations it has.
Yeah, even the other day, Caroline was on a call about assisted living, and I, was trying to get some information, and they said something, and I said, "What is that? What are they talking about?" And I worked here for years, and I had no idea what the acronym they were using, what that was referring to. So it's just to help everyone be informed. It's better to not use them.
And more, there are acronyms relating to therapy. So in a nursing setting, is usually the most common place for therapy to come about. And there's all different kinds of therapy. Sometimes for assisted living, there may be outpatient therapy available. And outpatient therapy means you're not staying overnight in a nursing center to get therapy. So sometimes outpatient therapy can come to you where you live, or sometimes you may go to the outpatient therapy place. Knollwood has an outpatient therapy place.
Yep.
As well as we do have inpatient therapy too, but tell us a little about the outpatient therapy location or place here.
Yeah, we have a great therapy gym, and the residents can go down and meet with physical therapists, occupational therapists. They do speech down there too, don't they now? And there's different equipment that they work with. They also will use, their own body weight and work with them just throughout the community.
Yeah.
It's important for balance.
You're right. Just helping them actually, with the occupational therapy, it may just be learning the best way to get off out of a chair.
Or in and out of your car
And that-
after a hip surgery.
Yes. So, almost every time I go by our therapy gym, there's residents from all neighborhoods in the community, working with therapists. So,
And just to kind of clarify too, therapy is usually it's usually prescribed by your doctor. So it's not the same as like a gym membership. You just stroll in and use it.
right.
So it's going to be prescribed, and then your insurance is typically going to have some sort of role in covering that. Yeah, I think we have another question on that I can't read, but
Oh, yes, the Q&A, I think.
yeah. It's too
Is there a separate charge for using a therapy gym, or is that included in the regular cost?
I think we just covered that.
Yeah.
Yes. So, yeah, so we know it has gyms, but a therapy gym is where the therapists work with people. So they have equipment, they can only take it because you're a patient. It's like if you go to the dentist, right? You're the dentist patient. So if somebody's using therapy, they're the patient of the therapist.
Yep.
So they have an appointment, certain things, there's goals for, either a certain amount of strength or a certain amount of maybe balance improvement, or, how much they can move their knee after a knee replacement. So that was a great question.
So most insurances will pay for physical therapy a certain amount every year after you pass a certain age, because it's actually shown that these therapies keep you from getting injured, and that's what the insurance companies want. So you can get physical therapy even if you don't necessarily have just had surgery or anything. Maybe it's because they want you to improve your gait. There's things like that your doctor will prescribe physical therapy for.
So you can always talk to your doctor about it.
Absolutely.
And more acronyms. These are typically relate to nursing care. So nursing centers all have an administrator. They all usually have a director of nursing or an assistant director of nursing. The nursing home administrator is always licensed, whether or not there's an L in the acronym. It's something that you have to be licensed for, and the licensure is by state, just like other medical practitioners. some places, I think California may be one of them, where many states have a nursing level that it's a licensed practical nurse, but some states you might see a licensed vocational nurse, and they're at the same kind of level as a licensed practical nurse. A registered nurse has more education than a licensed practical nurse, and therefore usually can do more services, more medical services. And will usually be the overseer of licensed practical nurses and nursing assistants as well.
We did touch on the aides before, and as mentioned, that they need a certification, and that companions are not certified.
Yes, and we do have, yeah, nursing assistant. Sometimes you may just see NA for nursing assistant as well, but most of the time it will be CNA.
Yeah.
But yeah, so these are common, and you're gonna find aides in the environment of like home care, assisted living, and nursing care, and they're the most hands-on people. Nurses really aren't going to help people like get dressed or brush their teeth, hair, makeup, any of showering. Usually it's always the aides who are doing all the really the hands-on of physical labor. So more, there's so many acronyms in the areas of nursing and assisted living, but most places are going to have a social worker. And so they could be a master's level, or they could be at the clinical level. A master's level is a little bit higher, but all social workers typically know a lot about either nursing care or assisted living or home care or therapy. And they can often be a good resource for people too, where to turn to for help on this, or someone needs to apply for Medicaid, insurance questions.
Exactly.
They're good.
We did get another question. What are we doing to attract and retain healthcare workers given the shortage?
We have a lot of people that have been here for a long time. We are very fortunate, knock on plastic table.
Our IKEA particle board.
Yeah, so we have been very fortunate in that. We've had to pay people more. I think people like working at Knollwood too.
I think there's a loyalty there. People feel connected to the community, to their residents. That's why we have so many who have worked here for so many years. There's one lady in assisted living.
29.
Yeah, I mean,
That's the longest of all. But our director of nursing has been here like 13 or 15 years.
Yes.
The director of nursing, a lot of the different aides that have been here for a long time. But I also think part of it, especially with the aides here, we don't have a lot of people leaving, but I also think it's because our staffing ratios are higher. If they went somewhere else, they would have a lot more manual labor than they do here.
That's what I was gonna mention. Absolutely.
Yeah. What's your thoughts on it?
They're treated really well here, which I love, like, because they have, well, and the assisted versus the nursing, so, they may not have to do 2-3 person assistants in our assisted living, where they may have to at other communities. And then we have, right now, I know that our ratios are 1-11. I don't know, that will be forever, but normally they're 1-14 to 15 in most communities, so.
Yeah, so if you have one person helping 10 or 11 people versus one person helping 15 or 16 people. Our nursing assistants here actually have time to breathe
In between.
and I think that might be why they stay.
Yeah. We're treated.
So, yeah, they are treated well.
great question.
So some of you may be actively actually looking for an assisted living center. This comparison, I think, is even more helpful when we're comparing assisted living versus independent living. So if any of you haven't seen that webinar, I encourage you to look at it. A lot of assisted living centers market themselves as independent living, but
Yes.
they're not. So you can see there's, on the other webinar, there's a comparison of it independent versus assisted, but here today, our purpose is comparing, assisted and nursing care. And Helen's dying to talk about it.
Dying to talk about it. So
Yes.
in assisted living, you're going to have typically some type of like smaller apartment home, might be efficiency, might be 1 bedroom, but you're gonna see something like a kitchenette. You're not gonna have any type of kitchen situation in nursing care. It is 1 room living, it's gonna be, hopefully be a little bit nicer than a hospital room, but a similar feel. Sometimes it's
And there will be a
private.
hospital bed
Yes.
in nursing.
Yes, exactly. It may not be the white plastic, it may be, like some kind of wood finish on it, which is real fancy. But yeah, it's gonna be a hospital bed. Sometimes it's private, sometimes it's semi-private. And assisted living and nursing, you're gonna have meals and snacks that are included. Now in assisted living, you're gonna see mostly employee cars in the parking lot.
They won't have a big parking lot at
No.
an assisted living place. A nursing place, if it's just nursing, they have a smaller parking lot. As well,
Yeah.
because no one's gonna be driving in nursing care, and assisted living is very rare that anybody could drive and need assisted living. Yeah.
With assisted living, you are gonna have hopefully a couple of different floor plan choices, not a huge range, but maybe a few differences. With nursing, again, it's all pretty much gonna be the same. Maybe you have like a room that has a little bit more square footage.
Or a different shape.
Or a different shape, but they're pretty much all gonna be the same. You're gonna have nurses and aides who are there 24/7 to help with care. And registered nurse will be on site for skilled nursing.
All the time.
Yeah, 24/7. And you're gonna have some type of physician who's overseeing the care of those residents, those patients, who's gonna be making rounds regularly. Another kind of tip or trick, and again, this applies more to assisted living versus independent living, is if you are thinking about independent living and you're going to visit a community, ask them the number of apartments that are licensed for assisted living.
Mhm.
If that number equals their total number of apartment homes, then they are trying to be a little bit tricky with you and it's not fully independent. So just putting that out there. And as I previously mentioned, there will be a social worker around or available to residents at the 2 levels of care here.
One thing that would be helpful, we could probably add this to the other webinar, but for those of you that are shopping, independent living doesn't take licensure. So like in Knollwood, for independent living, we have 160 apartments. For assisted living, we are licensed for 43 people, and it's in a different
Area.
Yeah, it's like its own. Heidi was talking about our community and neighborhoods. She was talking about neighborhoods within Knollwood. So Knollwood has the independent neighborhood, it has the assisted neighborhood, and then the nursing neighborhood is almost the same size as the assisted neighborhood. So, would you add anything?
Yeah, I was just gonna say, so when I think of assisted living versus nursing, I think of assisted living as like a really nice hotel room.
Mhm.
And nursing is like a rehab, if you've ever been in rehab. And also, I believe that a lot of people, when they don't want to go to a home, a senior living community. The whole concept of senior living really came out in the 80s, so it used to all be nursing care. That's what pretty much senior living people have in their mind sometimes. But assisted living is very different from that. It's, more of an apartment versus more of a room. Would you guys agree?
Yeah,
Yeah,
absolutely.
And there's another question, but I can't read this one either.
Okay. Yeah, they're popping up. They're popping
We
up.
love the questions, they're great.
Can you explain further how your memory care fits in with nursing?
Okay, it's at the nursing level.
Mhm.
Okay, so it's for people who are gonna have more acute, more medical problems, maybe very serious wandering. But definitely a lot more hands-on care. And how does it fit in with nursing? It's at the nursing level, so
Mhm.
it's not licensed for assisted living, it's licensed as nursing care.
Yeah.
Which means there's always an RN, there's physicians rounding. Assisted living, there's nurses, could be an RN, might not be. We do have RNs for assisted living, but it's not required that you have an RN on every shift. And physicians don't round for assisted living. People would go to doctor's appointments. We're licensed for 23 people, and our memory care neighborhood is connected to the nursing care, but it's separate because everyone who lives in our memory care neighborhood is suffering from a memory loss illness, and therefore is separate from people needing long-term care, long-term nursing care, or temporary rehab inpatient care. But it's connected but separate. What would
Yeah,
you
no, I was just gonna say, typically when we describe it, we say we have our skilled nursing umbrella, and under that you have long-term care, people with high medical needs. Memory care, so people who are suffering from some different type of dementia who may also have high medical needs, and then short-term rehab stays.
Mhm.
Some places, when you think of memory care, it's kind of like assisted living plus, where, okay, they're getting that same help, and maybe this particular floor or unit is a locked, secured unit. So if there's water risk, those patients can't get away. The big difference here is that if someone has those high medical needs, we can treat them in addition to also taking care of and being mindful of their dementia diagnosis.
So I was just gonna add, yeah, it's pretty much regulations, state regulations, and so to be licensed as memory care, the biggest thing is that they can't be able to wander. And you still may have with your disease, like Alzheimer's, people often no longer can swallow after they decline. And in assisted living, you're not licensed to feed people.
Right.
So those are one of the things that, like I was mentioning, when I used to have to discharge people, they no longer could swallow properly. So then they were on a mechanical soft diet, or they had to be fed. Those are nursing kind of things. And so that's what makes it so great that our memory cares and our nursing, because a lot of times with Alzheimer's or some of those really progressive dementias, they're going to decline, and you might eventually need those things.
Yeah, and that's such a good point, because I think a lot of people, when they think about Alzheimer's, they think, oh, well, you're just losing your mind. No, like, it's not just you're forgetting things, your body
muscles start to stop.
is shutting down as well. So yeah, you are at some point probably going to need medical assistance with some things. And so that's what we offer here.
And another differentiator too is communication. For assisted living, you really need to be able to somehow communicate
Yeah.
what your needs are. If you're feeling nauseous, or if you think you have a fever, or if you have a horrible headache, or
You're just thirsty or hungry.
yes, or you want to call your daughter. Where nursing care, somebody loses the ability to get across their needs, then the staff they're taught, they're licensed, they go through years of schooling, and they work with other people to try and determine how to best care for you, to make sure that your needs are met, not just your wants and desires, but your needs as well. Okay, so. Right, so we're gonna move on, and this is just give you a little bit more visual. So if you're in assisted living, you might see some people with wheelchairs or electric carts, but not all. Most of them, assisted living residents are going to be mobile. You might see more canes and walkers. There's going to be a lot of chairs in the dining room. And there's not going to be as many nurses around. There will always be a nurse or two around, but not several. In nursing care, you're going to see a lot more residents that are using wheelchairs. Fewer people are going to be using walkers or canes, unless maybe they're going through rehab and are, recuperating. You're not going to see as many chairs in the dining room either. So you may look in a dining area at a nursing center, and you'll see a table with 2 chairs instead of 4, or a table with 1 chair. You're not usually going to see a table with 4 chairs at it or 6 chairs at it. So that's kind of a visual cue, and you're going to see more nurses, and some of them are more administrative, like a director of nursing, or one who has to work on things like the minimum data set for care and insurance reimbursement, as well as a nurse that may actually come around and do treatments with you, or maybe you have a wound that needs checking or dressing. So you're going to definitely see more nurses in nursing care than you would in an assisted living community or neighborhood.
I wanted to point something out. I felt like our nursing here, I've been here for a little over a year. I was just really pleasantly surprised at how ours is very warm. So most nursing centers look more like a hospital and assisted livings look more like a hotel, like I said.
Mhm.
However, Knollwood's nursing is very warm.
Yes.
It feels like more like an assisted living by looking at it.
Yeah.
It has a very warm feel. There's carpet, there's the nice lights and.
Yes, there's been a lot of intentional design choices over the years to make sure it doesn't feel stark and sterile and hospital-like.
It doesn't. They did a
Be-
great job.
Yeah, because we do have some residents who live here in long-term care for a long time. One of my favorite things about both long-term care and the memory care units are outside of the rooms, they have these boxes where you can personalize it, put photos. So for memory care residents, that
That's
may
very
be
helpful.
helpful, like, old photos of themselves and their families. But it's just another way to add a personal touch in addition to what they can personalize within the room.
Mhm.
Yeah.
If any of you are thinking of assisted living for someone that think about this little checklist here that we're showing. I'm pointing to the wall, but you're looking at it on your screen. Because for assisted living, somebody has to be able to safely manage in their own apartment on an ongoing basis. Because your door is not propped open, it's your private space. Yes, will someone check on you? Yes, but they're not gonna be checking on you particularly every hour. They may check on you numerous times through the day, but you are expected to kind of move around on your own. And for the most part, transfer independently. And, you may decline. There may come a point where you can't transfer independently and may still be living in assisted living, but that may mean you may be headed toward needing long-term nursing care too. You are going to be eating without help. That doesn't mean that someone's shopping, cooking, prepping. Someone might even be cut your food, but no one's going to be actually feeding you. That's something that you're gonna be expected to do on your own as an ability. And the same with taking medications. You're probably not going to take it on your own, but if somebody becomes resistant to their medication, they may actually, sometimes it could just be some short-term problem that resolves itself in 5 or 10 days. But if it's ongoing problem of taking medications, that's also an indication that you're going to need more clinical people to help you, and maybe different types of medications as well. And you are going to be able to probably complete some of your activities of daily living on your own. Like maybe you can brush your teeth, but you just can't get the toothpaste cap screwed off, or maybe you can shower on your own, but maybe just getting in and out is a challenge. So you are going to be doing some of the activities on your own. If you can't do any of them to some degree, then you actually might be at the nursing level, or the person that you're thinking of might be at the nursing level. So your health conditions could be chronic, like arthritis, or maybe like a pacemaker, or maybe COPD, but it's going to be stable. Some illnesses progress, like chronic obstructive pulmonary disease does progress, but in the beginning, somebody might need assisted living and they have that illness. But if it becomes unstable or more acute, then nursing care is going to be a requirement.
And I would just like to add, if you're high fall risk as well, because like you said, people aren't going to be able to stay with you one-on-one. So, if you're.
And they actually don't usually nurse either, but they're more around.
There's more
much
people
often.
around.
Yep,
Yeah.
and checking on you much more often.
Mhm.
And some people don't know it, but somebody who's a fall risk is actually, I think from a medical or clinical perspective, I think it's somebody who falls more than once a year.
Oh, that's really.
Yep. That'll put it in like if you go to the
Watch
doctor.
out, Heidi.
I'm
Watch
a
out.
fall risk. I fell yesterday.
File.
You can call again this
File.
year. Yeah.
I fell yesterday.
But so clinically you're a fall risk if you have more than one fall.
I did not know that. Crazy.
Well,
The more you know.
public service, no.
Exactly.
Who wants to talk about nursing candidates? Nobody.
Sure. So similar to the previous slide, just talking a little bit about how if you're looking for someone for nursing care, what that kind of person would look like really.
Mhm.
So they may need help with moving around, help with transferring. That's a big one. If they need help getting up and down, if they're not able to participate in that and two people need to pull their weight up, that is a nursing candidate. They need help getting that food from the plate to their mouth.
Yeah.
Nursing.
Mhm.
If they can't participate at all in their continence management, and again, with the activities of daily living, it does depend on how much, how little, and to what degree, I suppose. Like Caroline mentioned, maybe you can brush your teeth, but you need help with taking the toothpaste lid off. That's different. Than needing help with all of your grooming. You can't brush your hair, you can't brush your teeth, you can't do any of that stuff. And if you have chronic, but sometimes acute health, so
And brittle diabetic is one.
exactly, that's a great example.
Or someone with a stage 3 or 4 wound.
Yeah.
Mhm.
That's another good
Yep.
example.
Yep.
Mhm.
I'm trying to think, there's a lot, somebody who is maybe in more of an end stage of an illness.
Mhm.
Yeah.
Where it's changing, maybe almost daily or weekly,
Yes.
sometimes the beginning of illnesses are kind of slow and mild. But kidney disease,
Yep.
Parkinson's disease, a big fall risk, talked about that,
Mhm.
that's acute danger.
Mhm.
And then you have to be ambulatory to be in assisted living. So if you're not ambulatory, you'd be more of a nursing candidate. And that means like you could be in a wheelchair, but if you can't propel your own wheelchair at all, then you'd be a nursing candidate.
Because sometimes people have a disability.
Mhm.
So I, could be somebody that has MS, but I could still manage my household, do my activities of daily living. Maybe I need some different equipment, but I could also be somebody who has progressed in the MS and maybe I really can't do things for myself anymore and I'm more of a total care.
Yeah.
If somebody can't be left alone, like for a couple hours or so, or 3 or 4, or you have to have someone stay overnight. Those are signs that they might be more nursing care, maybe not, but might be more nursing care
Mhm.
than assisted living. And sometimes though, people do have acute things that happen short term.
Yes.
Like if you had shoulder surgery, you might not be able to do several of your activities of daily living.
Mhm.
But it might be short term, so that doesn't necessarily make you a nursing candidate. It may make you a rehab candidate, or for therapy, but it may not make you a nursing candidate if something is short term or being corrected by surgery or something.
Yeah.
Okay, we're good on that. Oh, and then there's regulations.
Lots of regulations at both levels of care. For nursing, it's going to be both state and federal, and that's kind of the main difference. Some of these points we have already discussed in previous slides, things like having a medical director or a physician doing rounds at the skilled nursing level, that kind of thing. Okay.
So, oh, we're at the back of the
To
test.
yes, our favorite.
You
Back to
did
the
Julie.
test.
You did Julie.
I did Julie, yes.
Really?
So do you guys remember Julie? She was living in a,
Do you remember?
do you remember? She was living in a community where she had social activities and housekeeping and dining. And she gets around with little help. However, she's gotten problems with incontinence and she's got some medical issues and she cannot be trusted for diabetes. So where does Julie live?
And I think some of the cute clues, she has quite a bit of trouble with incontinence, several medical issues requiring monitoring.
And she can't be trusted with diabetes.
Yeah, exactly.
Yeah. So a medical issue that requires monitoring is something that is going to be unstable or maybe acute or both.
Yeah.
So that was kind of a big flag there. Quite a bit of trouble with incontinence. Incontinence does become more common. Sometimes it could even be temporary, but most often it might not be. But sometimes if somebody is incontinent, it might be they can help with managing it, or maybe even change their product, or tell somebody that their product needs changing,
Yes.
or maybe they can sometimes make it to the restroom and sometimes not. Or maybe it's just at night, but when there is a lot of trouble, especially if it could be fecal and urinary incontinence, and the person is less able to either manage or address the challenge, then that could often be a nursing.
All right, next test. So we've got Jane and John. Some things, that we mentioned were the programs, the housekeeping, the dining, that's all available to them. They need medication reminders. Think about that. Their apartment has a kitchenette. Think about that. Jane gets help with showering, and John has a stable but chronic illness. Okay, so hopefully those couple things that I pointed out really reassured you that it's assisted living. I mean, the kitchenette, to me, that's always going to be a dead giveaway. But they're getting a little bit of help.
You should say what a kitchenette is too. What's in the kitchenette?
So in a kitchenette, you're going to have microwave. Maybe.
Yeah, sometimes yes, sometimes per
Some-
person.
Yes. If it's risky, if you want to put metal in that microwave, we're not gonna let you have a microwave in there. Smaller fridge, not a full size, but
But usually
maybe-
have, here it also have a freezer for your
Yep.
ice.
which is nice. You're not gonna have something like a stove. But you have some cabinet space. It's a small footprint. It's similar, like Heidi has mentioned, to
The kitchen in a hotel.
exactly. It's
Or
something that,
dorm.
it's something that you might see like in a hotel room where, if you want to store a couple snacks or some drinks, you've got the space to do it.
Yeah, cupboards and,
Yep, cupboards and that kind of thing.
but usually not a dishwasher either.
Right,
Not usually, because you're not cooking
right.
in assisted living. So there, you might be having some snacks or coffee when you have friends over. or
Exactly.
Wine glasses if you're,
Yeah, and there's a sink,
your-
so if you need
can
to
wash it.
wash it, you just hand wash it, no big deal. Okay.
next
And-
time we should just do a trick test where they're both the same level.
That's a good idea. Pricing, I know we had someone who asked a question about pricing,
Yes.
what is the price of assisted living?
Mhm.
So we're
Ours
gonna
is,
talk about
yeah.
that here.
Yeah, our nursing care is easy, whether it's the memory care or the long-term care. It's $560 a day. Our assisted living, we have a couple of different apartment sizes in assisted living, and I have my cheat sheet here.
Yeah.
And we also have levels of care in assisted living. So for assisted living at Knollwood, you're going to pay anywhere from just under $9,500 a month to maybe $1,200 a month for the highest care level and the largest apartment here. So a wide range. If anybody wants to learn more, Heidi or Helen, and if they're busy, I could meet with you. But most of the time you'd be meeting with Heidi or Helen, and you could email us your email address if you'd like a tour, or put your phone number in our chat box or our Q&A box.
Yeah.
And we can call you and set up a tour. If you have somebody, just to let people know, we do not tour nursing care or even assisted living right now for someone who's just curious. Mainly because COVID, RSV, and the flu. We don't have any here. We
Right.
don't want any here.
We want to keep our residents safe.
And our
plain
staff
simple. Yeah.
too. So but if you are looking for assisted living care for somebody specific and you think that's going to occur in the next couple of months or before the holidays or right after the holidays, then we would definitely show you around.
Yeah.
But nursing care is, right now we have a waiting list, so we usually don't show people until we have an opening. Our nursing center is small and most openings go to people who live at Knollwood already, but not always. So we do often hold back on nursing tours unless we have something that somebody wants. Yeah. This
So-
is some pricing from
Yeah.
the DC area,
Which is
probably
good.
probably need to update that for 2023.
Yeah.
But these are just kind of average pricings that found through research that I do, which is usually through a cost of care survey that's nationwide. But it breaks down, and one of the markets, of course, is our DMV area, so.
I just want to put a plug in there that we also have respite. So if
Oh,
you
yes.
needed a short-term stay, they're popular during the holidays, or, some people,
And it's for assisted living.
it's for assisted living,
Yes.
yes. So, it's a 30-day minimum. We're not gonna get into the details here. Give us a call if you're interested, but sometimes, you're just not sure you want your loved one to go to assisted living. They're staying home with family and with care helping, and somebody needs to go on a vacation, a wedding, a break. Or maybe some construction needs to happen to a house. There's all kinds of reasons for a short-term stay, but we do have respite.
Yeah. So
More tests.
more testing, more questions.
Sure.
Medicaid covers assisted living costs.
Is this true or false?
So. Yeah, it's not. It's totally clear cut. It's mostly false.
Mhm.
There are some places that Medicaid does cover assisted living, but in general, you're gonna find Medicaid is most applicable to nursing care.
There are 3 places that accept Medicaid and assisted living in DC. I don't know how many there are in Maryland, not very many.
No,
Guess,
this is 2 in DC, but,
yeah, it's 3.
no, if I had to guess, I know Maryland has more,
Correct,
but still, it's
Big.
probably 5 or 6.
Right.
Yeah,
right, it's very
and some
rare,
states don't have any.
correct. I've worked in many places where they don't have a Medicaid at all. Where there is a Medicaid waiver for assisted living, typically there's a long waiting list. So. And often I know when people are looking,
It's immediate,
yeah,
yeah.
it's more, yeah. It's imminent.
Yeah.
So, yeah. And the Medicaid thresholds will change next year, which is just a few weeks away.
Yeah.
But they don't go up that much, but, if you don't meet, the income threshold, then there's no need to bother looking into any of the other thresholds. But there also is a threshold to be eligible for Medicaid and the Medicaid waiver.
Okay, another one, Medicare covers assisted living costs, true or false? No, it doesn't.
Nowhere.
No. Yeah. Medicare, you're gonna see typically if someone has a rehab stay. That's where, you would have Medicare picking up the majority of those costs for a certain period of time, and there's qualifiers to that kind of stay. But not for assisted living.
And even not for long-term care.
Yeah.
All of you watching, and maybe many of you watching, have a Medicare card in your pocket. And you use it when you go to the doctor, if you go to the hospital, or maybe you have a prescription coverage. That's what it covers. So you're gonna be using it pretty much in the same way. The only difference is if that you are prescribed therapy, whether it's in or outpatient, then you may be able to use that. So it's not for assisted living, but it may cover nursing care or therapy services.
Mhm.
In addition to your hospital prescription coverage and doctor visits, tests, that kind of thing. Okay. Is there another question up there?
Yeah, and I got booted out off my phone, so I'm gonna come over here, so,
Okay,
They
you
can't-
can do that.
yeah, because we've got two. I tried to log back in, but it didn't like me. Okay, so let's scroll down.
So-
Here we go.
It's showing.
Okay, can someone
You
progress?
wanna-
If someone progresses from independent living to assisted living or nursing care at Knollwood, do they keep paying the monthly fee? Can you repeat the assisted living costs, and will you accept someone into independent? What happens if they run out of savings later on? Do you kick them out? Yep, yeah, and that's only a part of it.
So with, so the assisted living costs, you can always call and meet with
Call.
us. Yeah, call us, because again, it's
There's
just under
levels.
9,500, and it can go up to 12 grand if you want the biggest apartment and you need the most care, but
Yeah,
call us.
it
Because there's a
depends.
lot that goes into determining someone's level of care.
exactly.
It's way too much for a webinar. It's actually more one-on-one because,
Yeah, it's individualized.
right, because we can actually go through kind of a checklist and help you kind of
Absolutely. Get a sense of what that figure could
what
be.
the level might be
Mm-hmm.
for your person.
And the only way to really know is have an assessment once you're ready to move into Knollwood, but
Right,
I mean, it really requires.
because a clinical
full
person
assessment
does
to
the
know.
assessment
Right.
to
Yeah.
determine.
Right.
um,
What your actual
But
care plan will be, and then
Right.
you're charged according to your care plan.
But you know, some of the things might be something you know the answer on, like how many medications does the person take?
Yeah.
You know, but some of the questions you know, may not be able to answer. Anyway, you know, that might be about their communication or something. But if somebody outlives their funds at Knollwood, we do not ask them to leave. We do have a care fund that we would help. And we would not help somebody who intentionally gave away or hid money, however.
Right.
And there is a financial eligibility when people move here because while we are a nonprofit, we do not and cannot help everybody. So when people come here to live, whether it's in independent living or if they come in assisted living without having lived in independent living first, we do a financial review. And somebody is eligible if it is unlikely that they would outlive their funds. We would not have somebody who came who it was a given that they were going to run out of funds.
Mhm.
And then we help those who would outlive their funds. We're not going to pay their entire way because they probably still have some maybe they have social security or maybe a pension coming in, but we're going to contribute so that someone doesn't have to leave.
Yeah.
Did I cover what that
And there
was?
was one question that was kind of asking, what happens if you come into independent living and then you move to a higher level of care?
You're going to pay for your care.
You're
at
gonna
the time.
pay, right? So you would go from paying the independent living monthly service charge to paying, if you move to assisted living,
Mhm.
whatever is that level of care, whatever you're assessed for.
Mhm.
Or if you go to skilled, the daily rate.
Mhm.
So if you have more questions on pricing, definitely recommend calling us, or if you have our email, you can email us, but it's best to call us so we can figure out.
Yeah, email is too hard.
Yeah.
It's like a conversation is better, or you could come in person.
Yes, but
Mhm.
we prefer
It's
not,
hard.
no walk-in
Yeah.
appointments. if
Oh, yeah, you
possible.
have to you have to come with an appointment. It's still COVID, RSV and flu.
Yes.
So you don't want to just stop by.
Yeah, but yeah, call us and we can get you the materials, talk through any questions you have. If we're not explaining it well, we can try and explain it in a different way to make it a little bit more clear. Okay. And back to payment.
I've got to go back one. Yeah.
Yep.
Yeah, so independent living, you're using your own money, just like you are in your house.
Yeah.
Maybe you have things automatically deducted from your accounts, or maybe you're someone who still writes checks. Assisted living, typically a combination of either personal funds or if someone has long-term care insurance and they qualify for their policy. They have to meet minimum standards and every policy is different. If you have a long-term care insurance, let us know and we'll invite you to our workshops,
Yeah.
which are very hands-on and you have to bring your policy or we can't help you understand it. And it's not for people who don't have policies. The workshops are for people who do. And again, Medicaid rarely covers assisted living. There are very few places that offer Medicaid waivers for assisted living. So mostly you'll be using your own funds. Nursing, it could be Medicaid, it could be Medicare, it could be your own funds, or it could be long-term care insurance. So those are all the payment sources.
Mhm.
That's really cool.
I'm not familiar with putting my glasses on.
Oh,
So I'll help you out.
Thanks.
I'll help you out. So this is just kind of breaking down Knollwood, just Knollwood. So independent living, that is our largest neighborhood, just under 70%, 69% of the people who live here live in independent living. We've got a mix of singles and couples. We've got so many floor plans and so many apartment sizes, your head will explode. And then if you come into independent living, you have priority for the higher levels of care if and when you need them. As previously mentioned, assisted living and skilled nursing which is long-term care and our memory care units combined. They are about almost the same size. We are licensed for a few more beds than we have in assisted living, but combined, they are 31% of our population here. So our two smaller neighborhoods, we have mostly single people living there. It's not common or typical for a couple to move to assisted living. It does happen occasionally, very rarely, but it is not typical. For our assisted living, we do have a few sizes of apartment homes, but most of them are going to be, we have like a
One bedrooms.
standard 1 bedroom that is pretty common. Most of them are that one size. For nursing care, one thing that's very nice is we are mostly private rooms. We do have the ability to turn some of those rooms into semi-private, but
that can be semi-private.
yeah, I mean, that is
Yeah.
fantastic.
And
It's
none of
rare.
the memory care is only private.
Yeah, which is very nice. In our assisted living, we did have a deficiency-free survey, which is great. Our nursing care is 5-star rated. And if you are in assisted living, you have priority for long-term care or memory care. And if you are at any level and you are going to need rehab, if you're getting surgery, hip replacement or something like that, you have priority for our rehab. Okay.
And we also have outpatient rehab and
Yeah.
and when I say outpatient, the outpatients are really only people who live here.
Right.
So like if you live 3 blocks away and your doctor prescribes outpatient therapy, you're like, oh, great, I'll call it Knollwood. Well, no. Outpatient means for residents of independent or assisted who aren't living in the nursing center.
Yeah.
For the most part, or a nursing center residents technically could get outpatient as well, but yes.
Okay.
And then these are just some resources. So you could take a screenshot of this, or you could come back to our website in a day or two. And this webinar will be posted.
Yeah.
But these are some resources that where when we're giving you information about different regulations, these websites can help you. And like lawhelp.org/DC. Well, there are 50 other lawhelp.org/Hawaii or /Maryland or /Montana. And then same thing with DC Health. All states have a health department, and that is what typically oversees assisted living. But then federal laws govern anything related to Medicare. The Genworth Cost of Care Survey, the 2022 survey should be out soon. I should look. But I get a lot of data about different states and what their costs of care are, which are often helpful if someone has a long-term care policy. And then Medicaid planning assistance. Again, when you go to that website, there's going to be a state by state and the district that you can look up there as well. So if anybody has any last minute questions, we're going to put up a slide on what we want you to do next. We want you to come and see us in person.
Yeah.
If you're out of state, like not like Maryland, that's out of state, but that's close by. But maybe someone is watching from Ohio and you'd like a virtual tour. We can do a virtual tour too. So you'd want to call us, and I didn't put our phone number up there.
Our phone number is 202-541-0149. That's the main marketing line. It rings at Carol Ann's desk, and our colleague Elise, who's not here today, it rings at her desk as well.
And you can ask for Helen or Heidi at that number.
Yep.
Or you could call Helen or Heidi directly.
Yep, if you have our direct line. You can also
You can tell
always.
us your direct line.
I
number.
don't do that to me.
You can also.
You don't know your phone number?
You can also.
Not on the spot like that.
Always
I do.
go on our
I have my card on my
website,
desk.
knollwoodcommunity.org. There is you can ask to be contacted through our website, knollwoodcommunity.org as well.
Yeah, there's a way you can send us an email from our website, or you can send a more in-depth inquiry with a web form through our website. And just for the record, Helen's number is 202-541-0234.
It is. Call me. I'll be there.
Or
Do you know mine?
202-790-5619.
Yeah.
Yeah.
Okay.
See,
I was about to give out Carolyn.
Oh,
We won't give out Carolyn.
I thought I
Um,
had mine memorized, but I did not want to make a mistake on here. Have
You
you
don't call
calling
yourself?
like somebody
Right.
else in the building?
Our next webinar is going to be in January in the new year. So it's going to be an intro to Knollwood. Just a great general overview of our community.
And that's focusing mostly on independent living.
Yep.
So, if you're thinking about independent living for yourself, then you might want to watch that one or come and take a tour before that. We're happy to, you get the most individualized information on a tour.
And if you're watching this, you're obviously a planner.
Yeah.
And if you're planning ahead and you're thinking, okay, maybe I don't necessarily want to end up in assisted living or nursing, what can I do differently? Move into independent
Yeah.
living while you're healthy.
Because most people don't need assisted living or nursing when they live in independent
Yes,
living
if you look at
first.
the statistics, people who live in independent living communities often do not end up needing assisted living or nursing. And call me and I'll tell you why.
And that's why our nursing and assisted living only comprise 31% of our campus.
Yeah,
And the large part of our campus is for people who are independent.
Mm-hmm.
exactly.
So, yeah, you're not gonna fall off a ladder. You're good.
I'm not gonna fall down those stairs
Or socially isolate in your house, which can impact you cognitively.
or eat only TV dinners for the next 2 years.
That sodium level up.
Or Vicinitas, what is
Yeah.
that one?
Yeah, so, we appreciate everyone's time today and we hope you will reach out. If you had a question or if something pops up and we didn't go over it, please do not hesitate to contact us.
You can Call us or reach us through the website.
Yeah, and we'll be happy to follow up. And if you do contact us through the website or send us an email and it's something that's more in depth, we will call you.
Yeah.
To follow up, because it's just easier, as Carolyn had mentioned, than doing like a whole long page email where things can be misinterpreted.
And we
Okay.
can't ask, it's hard to ask questions going back and forth with email as well.
Yeah.
Because sometimes someone will ask a question, you're like, and then that question is like, well, I can't answer that until these other 4 questions are answered, and that's really hard by email. We're non-pressure, we're fun, we'll make you laugh. And if you are calling, because you're, people who need assisted living or nursing care, they're not investigating. So you might have watched this because you're investigating for someone, so we do hope you'll call us.
And we actually have,
Opening.
yeah,
We have an open, we have an opening.
we have an
do have
opening
in
in
assisted
assisted
living.
living, so call us, please.
Right, we don't have a respite opening today, but we may
No.
have a respite opening later this month.
Maybe in
Mhm.
January.
But we do
Yeah.
have a residence, an opening for a residency.
Yes, yeah.
And just FYI for respite, many people might not even, I know Heidi said what it is, but it's kind of like going on vacation where you pack your suitcase. But the person will be staying in a furnished apartment, there's dishware and, an alarm clock and, paper towel and soap and things, TV and cable and internet. So, but someone would come and, there's a landline.
Just bring your luggage and
Yeah.
your medication.
Yeah,
Mhm.
and toothbrush.
Your toothbrush.
Toothbrush.
Pronounced
Just
shit.
like you're going on vacation.
Yes.
Exactly.
Okay.
Just don't forget the medication.
Yeah, we've got one more Q and A. I'm gonna hop down and
There's
read it.
one more?
Just one more.
Okay.
Okay. All right. Thanks for bearing with us, guys. Next time Elise will be here and she'll be on it. Great presentation. Thank you and happy holidays.
Oh, well, thank you.
Well, happy holidays, everybody. I hope
Yes.
you're gonna enjoy some time with friends or family for Hanukkah, Christmas, Kwanzaa, and New Year's.
Yeah.
We'll see you after the new year. And
Yeah.
Boxing
Enjoy the
Day.
good food.
Yes.
I know.
Hopefully, yes.
Mm.
Bye, everybody.
Bye. Thanks so
Bye.
much.
Thank
See you
you.
next time, guys.